Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's February 2023 issue. There have been 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is a review article entitled Physical Activity and Cardiorespiratory Fitness as Modulators of Health Outcomes, a compelling research-based case presented to the medical community. It is authored by Dr. Barry Franklin from Beaumont Health in Royal Oak, Michigan, and colleagues from several other institutions in the United States. Human behavior and lifestyle are among the salient determinants of health and longevity, and high on the list of those determinants of better health and increased lifespan are regular physical activity and exercise. Yet, as is often the case, the salutary effects of physical activity and exercise are underappreciated or insufficiently emphasized in clinical practice. This review by Franklin et al. Provides a compelling synthesis of the health benefits of physical activity and exercise. The review begins with discussions of cardiorespiratory fitness and metabolic equivalence (METs), how these entities are defined and assessed, and the role of physical activity and exercise in promoting cardiorespiratory fitness. Drawing upon relevant literature published between 1950 and 2022, these authors summarize evidence demonstrating that increased life expectancy associates with regular physical activity, that there is an inverse association between cardiorespiratory fitness and assorted cardiovascular disease events, hypertension, atrial fibrillation, type 2 diabetes, and chronic kidney disease, and that an inverse relationship exists between cardiorespiratory fitness and cardiovascular disease and all-cause mortality. Higher cardiorespiratory fitness associates with improved outcomes after surgical procedures. Additionally, physical activity and cardiorespiratory fitness exert salutary effects independent of and synergistic with assorted pharmacotherapies. Finally, higher cardiorespiratory fitness associates with reduced healthcare costs. Broadly considered, the health benefits of cardiorespiratory fitness appreciably increase after cardiorespiratory fitness exceeding 5 METs and appear to plateau by 10 METs. In their review, the authors complement their synthesis of epidemiologic and clinical findings with mechanistic findings drawn largely from preclinical studies that focus on 3 main areas: the key cardioprotective effects of regular physical activity, which involve anti-ischemic, anti-atherosclerotic, antithrombotic, and psychological processes; the basis for exercise preconditioning as a cardioprotective strategy; and mechanisms whereby vigorous intensity exercise training may be more effective than moderate intensity exercise in reducing cardiovascular risk. The authors extend their discussion of physical activity and cardiorespiratory fitness beyond the leading cause of mortality in the United States, namely cardiovascular diseases, to cancer and COVID-19, the second and third leading causes of mortality, respectively. Both these diseases also benefit from physical activity and cardiorespiratory fitness. Individuals with higher physical activity and cardiorespiratory fitness have a lower risk for cancer and improve outcomes after the diagnosis of cancer, and are less susceptible to SARS-CoV-2 and exhibit less severe COVID-19 when so infected. The authors conclude their article by summarizing current guidelines for physical activity. Either singly or in combination, 150 to 300 minutes of moderate intensity physical activity or 75 to 150 minutes of vigorous physical activity per week, along with muscle strengthening sessions and restricting sedentary behavior. They also summarize minimum training thresholds including steps per day 7,000 to 10,000, MET minutes per week 500 to 1,000 MET minutes per week, and minimum exercise intensity greater than 5 METs. This masterful review by Franklin et al. Makes abundantly clear the role of regular and adequate physical activity and exercise in preventing and treating diseases. Such effective preventative and therapeutic strategies incur few, if any, risks other than possible musculoskeletal injury, entail relatively modest or no costs, and commonly convey a gratifying effect on one's mood. Their incorporation into one's lifestyle and counseling patients to do so cannot be emphasized too strongly. Our first highlight article this month is an original article entitled Pre-Admission and In-Hospital Statin Use is Associated with Reduced Short-Term Mortality in Infective Endocarditis. It is authored by Dr. Siyang Yu and colleagues from the University of Hong Kong in Hong Kong, China, as well as colleagues from other institutions in China and the United Kingdom. The adjective pleiotropic is often used to describe the multifaceted effects of statins, effects that were never predicted to emanate from agents introduced to inhibit cholesterol synthesis. Yu et al. Describe a remarkable salutary effect associated with the use of statins in patients with infective endocarditis. In this retrospective study, these investigators used a territory-wide database developed by the Hong Kong Hospital Authority to identify patients diagnosed with infective endocarditis between January 1, 1996 and December 31, 2019. Mortality was assessed in patients with pre-admission statin use for more than 90 days before the index date and in patients maintained on statins after admission. Respective control groups consisted of non-users of statins prior to admission and patients in whom statin use was discontinued after admission. The data demonstrate that pre-admission use of statins was attended by a 31% reduction in one-year mortality and a 29% reduction of mortality during hospitalization. Furthermore, mortality during hospitalization and mortality at 1 year was reduced by almost 50% in patients in whom statin use was continued during hospitalization. These beneficial effects associated with in-hospital use were dose-dependent, exhibited by different statins, observed in patients with streptococcal or staphylococcal infections, or in patients who were culture negative or without cultures, were observed in patients with other comorbidities or prosthetic heart valves, and in users of illicit drugs. The basis for such salutary effects may involve a decrease in bacterial growth or virulence and or immunomodulatory effects that reduce adverse inflammatory responses to infective endocarditis. As pointed out by Yu et al., these findings will require a multi-center randomized controlled trial to confirm these salutary effects associated with the use of statins. Drug repurposing is an unexpected therapeutic avenue discovered for drugs originally introduced for other indications. The intriguing findings by Yu et al. Raise the possibility of repurposing statins as adjuvants in treating infective endocarditis. Our second highlight this month is an original article entitled Association Between Proton Pump Inhibitor Exposure and Acute Kidney Injury After Cardiac Surgery. It is authored by Dr. Hee Byung Ko and colleagues from Yonsei University in Seoul, Republic of Korea, and from Wijanbu Yulji University Medical Center in South Korea. A sobering finding in hospitalized patients is that even a minor increase in serum creatinine, for example an increase of 0.3 to 0.4 milligrams per deciliter, is associated with significantly increased risk of death compared with such risks in patients with largely unchanged serum creatinine. There is thus the need in hospitalized patients to minimize the exposure to risk factors which singly or in combination may provoke even modest increments in serum creatinine. Medications prescribed prior to and at the time of hospital admission or during hospitalization may predispose to acute kidney injury during hospitalization. Coe et al. Examined the occurrence of acute kidney injury after cardiac surgery in patients exposed to proton pump inhibitors, PPIs, prior to surgery. These investigators analyzed two cohorts, a tertiary hospital-based cohort, the Severance Cardiac Surgery cohort, and a multinational insurance claims record-based cohort, the NHIS senior cohort, in PPI-exposed patients compared to PPI non-exposed patients. Incident acute kidney injury and acute kidney injury requiring dialysis was significantly higher in the former cohort, and acute kidney injury requiring dialysis significantly higher in the NHIS senior cohort. These associations persisted after propensity score matching and adjusting for confounding factors. They were not observed when PPIs were stopped 3 weeks before surgery, and as a negative control, no significant associations were observed between H2 blocker exposure and acute kidney injury after cardiac surgery. Interestingly, associations were observed for PPI-exposed and acute kidney injury in those patients exhibiting on urine analysis on the day of surgery sterile pyuria, but not in the absence of this finding. This finding suggests that interstitial nephritis may contribute to acute kidney injury caused by PPI exposure. In discussing their findings, Coe et al. Emphasized two considerations among others. First, prospective clinical trials are needed to further investigate this apparent risk of PPI therapy. And second, as PPIs may reduce the risk of gastrointestinal bleeding in patients undergoing cardiac surgery, the relative risk-benefit of proton pump inhibitors should also be considered and assessed. You can access these highlights articles and editor's choice articles free of charge during the entire month of February. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find links to our social media by clicking the buttons at the bottom of the home page, or follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on our home page as well as through iTunes. You will also find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content as well as articles published online in press. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.